There's been so much talk about regenerative medicine, stem cells, PRP. We've been getting so many questions and requests to do a show on that. So I'd like to share an interview that I had with Dr. John Munyak. Dr. Munyak is a premier sports medicine doctor, former doctor for the basketball team Nets and the New York Islanders hockey team. We had a detailed conversation about regenerative medicine, stem cells, PRP, and all other peripheral issues and things. So please enjoy, like and share, and follow us. All the very best. Hello, welcome. I'm Dr. Leon Popovitz, and today I have the honor of having my guest, Dr. John Munyak. Dr. Munyak is an internationally recognized non-operative sports medicine specialist. He's worked with very many athletes and dancers. He's consulted with the NBA, Major League Baseball, not to mention ballet dancers. John, it's a real honor to have you.
Honored to be here. Thank you.
So it's an interesting perspective, being that you're high regarded specialist in non-operative sports medicine, and I'm surgical sports medicine. So it's a nice compliment.
Definitely.
Yeah.
Yeah, it's great.
Yeah. And John works with us at New York Bone and Joint Specialist. He's one of our very prized and very valued doctors.
Oh, thank you.
So I wanted to really kind of touch on what's cutting edge, what's new, what's really coming out that's more and more options for patients. And it seems like regenerative medicine has really become the cutting edge as far as treatment goes, as far as options goes. So maybe we can just start with something simple and just explain to the audience what PRP and what regenerative medicine is.
So, the body has its natural rate of healing, and sometimes that's just not enough to get someone to avoid a surgical procedure that maybe they're looking to not get because it's going to be more downtime that they can't afford basically on their sport, their occupation. Just getting from point A to point B is sometimes someone's sport. So in many ways, and maybe they don't have the insurance that's going to cover expensive surgery. So they say, well, what else can I do? So you got to know all the options. What heals the body is the scar process. If you break a bone, it heals with bone. Everything else scars back together, and the body just has to have that ability to get that scar process to be faster than the injury process. How would you wear out your meniscus faster than the body can fix it? So you always lose that battle. So regenerative medicine can kind of even the score by injecting things that will help.
Very good.
Help enhance that healing process.
So the process in of itself basically is that we're using healing tissue from our own body and injecting it into the patient's either knee or shoulder, wherever the healing is needed.
Yeah, exactly. So someone has cartilage wearing out, someone has a labrum tear in the shoulder or hip, someone has a torn hamstring. You can really enhance the rate of healing tremendously depending on what they need to be enhanced. Mm-hmm. So someone's a high-level athlete. They say, well, I got a game on Saturday and it's Monday. We definitely got to use one of the big guns like, PRP or stem cells or maybe multiple PRP injections to, get them ready to speed up the recovery. And it sounds strange. Well, how come the normal person takes, up to 9 months for a hamstring to recover from? Even you read it all the time. Major League Baseball, this guy's out for the season from a hamstring in April. I'm confused by that also because I'll inject someone's hamstring on a Monday and all of a sudden they're running their best time on Saturday as a Division I track star.
Isn't that great? Isn't that amazing? It's extraordinary what's going on with regenerative medicine. So just dividing it up. So regenerative medicine includes, for the most part, PRP injections, plasma-rich injections, where it's basically drawn from the blood.
Yes, so it's their own blood. It's just as everyone unfortunately heard now in the news with COVID, where people are getting plasma, to help get rid of COVID. It's the same plasma, so
your own plasma.
Your own plasma, this time instead of someone else's, and you put it in the machine, spin it down. It's about 20 minutes spin, and then inject it back where we want to heal.
And the cells that we are capturing for the healing, they are the growth hormone cells and the cytokines that are stimulating the healing process.
Exactly. So the growth factors are predominant in the platelets. So that's why when you spin it down, spin the blood down, you get just the platelet-rich plasma, the PRP abbreviation for, and that's what's going to really stimulate best. So, there's all these kits out there that do that, and over the years we got kind of tired of the kits and the costs going over to the patient, and so we came up with our own way of doing it, and it's actually a stronger version because there's something called the buffy coat, which is the layer between the PRP on the top of the tube and the platelet poor plasma, which is your white cells and red cells, things that you don't need. And that little buffy coat is a layer that if you have a good steady hand, you can kind of suck that into the syringe. And we use 4 syringes. You're actually getting 4 buffy coats versus the 1 buffy coat you get if you use the standard kit. So I find our PRP is definitely even stronger.
So the more healing cells, the more plasma-rich cells you can capture, the more healing we can provide for the patient.
Yeah, exactly.
And other options as far as regenerative medicine goes, then next step is to get even more cells would be the stem cell option.
Yeah, so stem cells, people think, and it was even outlawed for a while by, former President Biden, stem cells in general, because there was this misconception, you're going to clone a sheep, but it's not that kind of stem cells, though. It's the healing version. You're not transforming tissue into something. You're, again, just enhancing the healing of what's injured, and that enhanced healing ability to, seal back together someone's labrum or someone's meniscus or hamstring, whatever you're trying to really enhance that. Maybe PRP didn't work for the long term, is really just an enhanced healing. So you have your prolotherapy, you have your PRP, and then you have your stem cells. Just really, that's the level of attack basically on the healing that these things do.
Let me touch upon prolotherapy real quick.
Oh yeah. So prolotherapy is another really long-term, long history of use, and again, hopefully gives a long-term result. So it's the same concept of trying to induce a scar that the body couldn't make fast enough. So prolotherapy is, commonly a sclerotic substance like dextrose or mannitol, and again, just decades of experience, you see what was the best substance. So you'll only see mannitol in our cabinets because that's the best one overall, just anecdotally and research-wise. It really works the best if something's going to work. So that one is, sometimes it takes multiple shots. I've had patients take up to 7 shots and find they're great with this. Usually you go 3, either weekly or every 3 weeks, depending on someone's schedule and what their, desire, how to get, the injury healed fast. And I find by 3 of those shots, if it really hasn't done much, then we'll switch to PRP. Or maybe they'll give up and say, actually, I'll just get the surgery. But
so getting back to the stem cell, so we got the prolotherapy is an option, but as far as regenerative, getting your own growth cells, we're going to potentially draw the blood for the PRP, and then the stem cell option is gaining even more cells, and it's your own cells. You're not getting cells from anyone else, although there are options like that too. But just speaking about using your own cells and the stem cells, where are those stem cells usually coming from?
Yeah, so you have this is called the BMAC or bone marrow aspirate concentration, and that's you make a little hole in someone's pelvis. Very benign procedure, even done in the office. It's anesthesia locally for that. Most people don't even feel a thing. And you get the bone marrow out, and then you put in a special spin also, and then you get your own stem cells from that. That's where the stem cells are forming in your bone marrow. And again, just same as the PRP. Then it's your own bone marrow, so no risk of anything.
So it's a turbo boost. So one way of doing it is getting it from the blood, but then if you really want to concentrate and really want to get as many growth or healing cells as possible, you can get it from the pelvis.
Yeah, you get it from the pelvis.
Bone itself.
Absolutely. And even more aggressive, which actually this kind of follows with people who want not only stem cells but possibly even to shrink down their abdomen size a little bit. It's the lipogems system.
Yeah, tell us about that. That's very interesting.
Yeah, so this is where you actually do a liposuction. Again, in the office, a little nick, you get in, everything's anesthetized with lidocaine. So people feel nothing or maybe just a slight little burn just because of the lidocaine stinging a little bit. And you're literally doing liposuction, and then you put it in the same kind of machine. It concentrates down your own mesenchymal stem cells from your fat, and then that's injected wherever the healing is desired.